Decreased amount of oxygen in the blood. Options are A. Hypoxemia, B. Hypoxia, C. Hypercapnia, D. Hypocapnia. The answer is A. Hypoxemia. Fracture of several ribs resulting in instability of the affected chest wall. Options are A. Fractured ribs, B. Flail chest, C. Pleural effusion, D. Pneumothorax. The answer is flail chest. An inflammatory occlusion of the peripheral arteries impairing the peripheral circulation. The options are A. Berger's disease, B. Raynaud's disease, C. Aneurysm, D. Varicose vein. The answer is A. Berger's disease. Normal hemoglobin level. A. 4 to 8 gram percentage, B. 1 to 5 gram percentage, C. 15 to 20 gram percentage, D. 10 to 14 gram percentage. The answer is D. 10 to 14 gram percentage. Decrease the amount of oxygen in the tissues. Options are A. Hypoxemia, B. Hypoxia, C. Hypercapnia, D. Hypocapnia. The answer is B. Hypoxia. Angina pectoris is a sign of. Options are A. Myocardial ischemia, B. Myocardial infarction, C. Coronary thrombosis, D. Mitral insufficiency. The answer is A. Myocardial ischemia. Average tidal volume. Options are A. 500 ml, B. 1000 ml, C. 1.5 liter, D. Less than 1.5 liter. The answer is A. 500 ml or 0.5 liter. The amount of blood ejected from the ventricles during each heartbeat. Options are A. Cardiac output, B. Tidal volume, C. Vital capacity, D. Stroke volume. The answer is D. Stroke volume. Reason for chest pain associated with myocardial infarction. Options are A. Decreased oxygen in heart muscle, B. Left ventricular overload, C. Circulatory collapse, D. Fluid and electrolyte imbalance. The answer is A. Decreased oxygen in heart muscle. Blood clotting is the function of. Options are A. RBC, B. Platelets, C. WBC, D. Erythrocytes. The answer is B. Platelets. Malignant increase in the number of erythrocytes. Options are A. Anemia, B. Thalassemia, C. Polycythemia vera, D. Thrombocytopenia. The answer is C. Polycythemia vera. Drugs that increase the bronchial secretions and aid in the expulsion of mucus are termed. Options are A. Expectorants, B. Antitussives, C. Bronchodilators, D. Mucolytics. The answer is A. Expectorants. Digoxin toxicity occurs when serum level of digoxin exceeds. Options are A. 1.5 mg per deciliter, B. 1.8 mg per deciliter, C. 2 mg per deciliter, D. 2.5 mg per deciliter. The answer is C. 2 mg per deciliter. The normal pH of arterial blood. Options are A. 7, B. 7.3, C. 7.42, D. 7.5. The answer is C. 7.42. Pacemaker serves the function normally performed by the. Options are A. Accelerator nerves to the heart, B. AV node, C. Bundle of His, D. SA node. The answer is D. SA node. Antibiotics are the drugs used to treat. Options are A. Infection, B. Inflammation, C. Pain, D. Itching. The answer is A. Infection. A side effect of digoxin. Options are A. Hyperkalemia, B. Hypokalemia, C. Hypocalcemia, D. Hypercalcemia. The answer is B. Hypokalemia. A patient receiving warfarin should report to the doctor. Options are A. Hematuria, B. Constipation, C. Dyspnea, D. Pruritus. The answer is A. Hematuria. A medication given to a patient with angina. Options are A. Digoxin, B. Sorbitrate, C. Metoprolol, D. Lidocaine. The answer is B. Sorbitrate. Side effects of morphine include A. Increased blood pressure, B. Decreased respiratory rate, C. Reduced mucus secretion, D. Visual disturbance. The answer is B. Decreased respiratory rate. Drugs that dilate bronchial tree. Options are A. Bronchodilators, B. Antitussives, C. Antibiotics, D. Expectorants. The answer is A. Bronchodilator. 0.45% of sodium chloride is. Options are A. Isotonic, B. Hypertonic, C. Hypotonic, D. Isometric. The answer is C. Hypotonic. Pulse pressure is. Options are A. Diastolic pressure, B. Systolic pressure, C. Difference between diastolic and systolic pressure, D. Deep pressure in the pulmonary veins. The answer is C. Difference between diastolic and systolic pressure. Edema is due to. Options are A. Increased permeability of capillary walls, B. Reduced return of lymph, C. Increased capillary pressure, D. All of the above. The answer is D. All the above. Signs and symptoms of salicylate toxicity include. Options are A. Chest pain, B. Pink colored urine, C. Slow pulse, D. Ringing in ears. The answer is D. Ringing in ears. The best indication that fluid replacement for the client in hypovolemic shock is adequate. Options are A. Skin feels warm, B. Systolic blood pressure above 100 mm of Hg, C. Diastolic BP above 90 mm of Hg, D. Urine output more than 30 ml per hour. The answer is D. Urine output more than 30 ml per hour. Autonomic rhythmic contractility is characteristic of. Options are A. Cardiac tissue, B. Nervous tissue, C. Connective tissue, D. Muscular tissue. The answer is A. Cardiac tissue. World Heart Day is observed on. Options are A. 21st September, B. 28th September, C. 10 October, D. 14th August. The answer is B. 28th September. The chest pain resulting from inadequate blood supply to myocardium. Options are A. Right heart failure, B. Myocardial infarction, C. Angina pectoris, D. Left heart failure. The answer is C. Angina pectoris. The drug given to relieve pain in myocardial infarction. Options are A. Acetyl salicylic acid, B. Tramadol, C. Diclofenac sodium, D. Morphine sulfate. The answer is D. Morphine sulfate. Inflammation of the parietal and visceral pericardium. Options are A. Cardiac tamponade, B. Myositis, C. Pericarditis, D. Angina. The answer is C. Pericarditis. The drugs that inhibit cough reflex. Options are A. Bronchodilators, B. Expectorants, C. Antitussives, D. Antibiotics. The answer is C. Antitussives. Volume of air going in and out of the lungs in normal quiet breathing. Options are A. Vital capacity, B. Residual capacity, C. Inspiratory capacity, D. Tidal volume. The answer is D. Tidal volume. If you find the video useful, please subscribe.